Hello and welcome to the Healing Clinic. I'm Grace Hesey and I'm lucky enough to have Dexter Lynch with me. Errol Dexter Lynch, as you remember from last week. Hello.
Hi.
Now, we've got a lot of things on the table here that look a little bit odd, but we've seen some of it in the news recently with Gwyneth Paltrow having a cupping session, or with marks on her back that she's had a cupping session. So you're going to talk to us today about cupping. I don't really know what cupping is.
Right. Cupping therapy is different, or it's an adjacent to many other therapies. So with acupuncture, shiatsu, Tuina, they actually use cupping at the end or during the treatment. There's not many places that you can actually get cupping on its own. And on the table here, we've got 4 different types of cups. And in the clinic, we've got Untitled that uses these 2. And it's used for pediatric, for children. And the reason is that they can actually play with the cups, and they're not very aggressive.
This looks a little bit like a fire hydrant, doesn't it?
We'll put out the fire later. Yeah. So when they're on, just by putting it on this way, by taking the air from inside, it stays on the body, and this is actually cupping.
Oh.
Yeah. And the one you have in your hand is just as gentle. You just twist it a little bit, and then it takes the air from inside, and then it can also stay on the body.
So it's acting like a vacuum.
Yeah, this is what cupping is. Yeah, vacuum therapy. Sorry, what it does, it draws the blood from deep inside, if you've got blood stasis, to the surface of the body, and then the body's circulation can actually carry the blood away.
So I'm going to have the benefit of a demonstration from you to see how it feels. And what should happen after the cupping session then?
Right, well, not just after, also before. By using cups, it helps the body to relax. After, sometimes the cups become diagnostic as well as treatment. So if the skin is quite red after the treatment, it says that the blood is in stasis. If the skin is quite clear, it says the blood circulation is okay.
Well, thanks very much for that. Let's go over and have a demo.
As discussed earlier in the interview, we spoke about the different variations of cups. And one we actually showed you was the one for pediatric cupping. And I showed you on my arm, but I'll give you an idea of what they feel like on the body.
Okay.
As an adult, you probably won't feel anything. Yes, it's actually very, very soft and gentle.
Yeah.
And with this, it sucks out the oxygen, so it allows the cup as you go into it, or the air. And so once you place it on, then you twist it. Yeah. And so for children, it's actually very, very gentle. But for an adult with more muscle, what we want the cups to do is actually draw the blood or blood stasis from deep within the muscle tissue up to the surface, so it can actually carry away by the lymphatic system. Also with cups, the skin and the muscle fiber is actually dragged into the cup, and so it actually stretches the skin, also the muscle fibers. So when I take the cup from the body, then the muscles can actually relax, and having lengthened muscle will take away pain and so on. To do this, we need to use some alcohol, a lighter. And so by doing so, we can actually take the oxygen from the cup and then place on the body.
I'm amazed at that actually. I thought it would hurt, but it doesn't. It's quite a funny sensation because it's like, I feel like it's sucking or pinching.
What is nice with the cups, which is quite different to most massage, is that it actually pulls the skin and the muscle upwards. So with massage, all we have mostly is perpendicular pressure. Yeah. And if you was actually injured, I would actually use the cups before I actually do the treatment, so that it can draw the blood and move the blood. And here you can see some of the red marks. Yeah, that's on the skin. There are different methods of actually using the cups as well. So this is a glass method. We also use bamboo cups as well. Say it again.
And why do you use the different types?
With the bamboo cups, we can actually get more cups in a smaller space.
Oh, right.
So around the shoulders, we can actually stack the cups quite close together. Whereas if you're using the glass, it's quite a big distance apart. So with shoulder pain, you can actually cover the whole shoulder, then stretching all the muscles of the shoulder area. And the more cups you use, actually the more relaxing it is as well. So these are two of the ways you can actually use the cups. The last method is by the use of oils.
And how long does that sort of marking stay on the skin?
Right. The marking, as spoken about Gwyneth Paltrow earlier, can actually stay on the skin between 4 and 7 days, but it does depend on the individual and if they've got blood stasis at all.
Just explain to me what blood stasis is.
Blood stasis is where the blood and moving within the vessels is actually moving very slowly, and so it stagnates, it doesn't move, quite sluggish. And the last way we use, you can also do cups after you've done a massage. So you do the effleurage first. Your skin is a little dry, so we use some different oil which we can get on.
And how often would you have to have this done?
Right. Because what cupping is used for is used in adjunct to most therapies. So when you go for the acupuncture, you can have cupping as regular as that. And this is the last way, one of the other ways that we use it, that we can actually use the cup with the oil to move the muscles around. And this one, isn't so unpleasant. So it's like a massage.
Yeah, it feels like more like a
by itself.
massage, because it feels sort of deeper muscle.
And right. Also, there's one more way that we use the cups as well. And this one is you have to be quite good when using the cups. And we use this method when the person's got colds or flu, and how the cups are used. It's very, very quick. And then you take them off. And what's happening is that I'm also stretching the muscles that are around the intercostals. So therefore the body's able to clear cold and flu much easier.
Well, thanks very much for that. That was an experience. It didn't hurt, which I was thinking maybe it might do, so you can give it a go if you want to do that in adjunct to acupuncture or something else. And that's all we've got time for today.